Hello, everyone. I'd like to start today by asking everyone a question. If one of your closest friends developed a substance use disorder tomorrow, would you know how to recognize the signs or help them find treatment? This topic of substance abuse and substance use is very meaningful to me because I grew up in a family affected by addiction, and I've also experienced my own struggles with substance abuse and alcoholism as an adult. And these experiences have inspired me to learn more about addiction from a scientific and medical perspective instead of relying on what I thought I knew based off of stereotypes or stigma. And today, what I'll be doing is explaining what substance use disorder is, why stigma can make recovery more difficult, and what evidence based treatments can help people recover. Before preparing this presentation, I wanted to get a better understanding of what my audience already knew about substance use, so I conducted a short survey. And one result that really stood out to me was that over 80% of respondents said that it would be easy to obtain alcohol, vaping products, marijuana, or other drugs. I do believe that vaping products and nicotine is a really, really big one right now, especially as tobacco industries push out more diverse flavors compared to what I remember growing up with, which was just regular cigarettes. But this, regardless, tells us that access to substances isn't necessarily the biggest challenge, and it's something that many people encounter in their everyday lives. I also found that more than 90% of the respondents believe that substance use can negatively affect mental health, relationships, academics, and overall well being. And so, while most people recognize the risks that are associated with substance use, awareness alone does not always prepare us to recognize the signs of addiction or even know how to help someone who may be struggling. And finally, another thing I noticed was that several respondents shared that they know friends who use alcohol, vaping products, or other drugs, and nearly half reported seeing substance use among their peers. These responses show that substance use isn't a distant issue and it exists in many of our schools, communities, and social circles. These survey results are exactly why this topic is important. Addiction doesn't just affect the individual using the substances, it can affect families, it can affect friendships, and it can affect entire communities. And by taking the time to really understand what substance use disorder is, recognizing the role that stigma plays, and learning about effective treatment options, we as a society are better prepared to support ourselves or even someone that we really care about when they're looking to get help. So, when talking about substance use disorder, a lot of people are going to think that addiction is simply a matter of willpower or poor choices. I have heard a lot of people tell me, why didn't you just stop? If you know that it's causing harm, why didn't you just put it down? It's not that easy, and research supports that. Research shows that that is not the case. Substance use disorder is a chronic medical condition that changes how the brain functions. It affects areas responsible for decision making, self control, learning, and reward, making it increasingly difficult for someone to stop using a substance despite harmful consequences. And another thing that people may not realize, but sugar affects the brain in the same way that using recreational drugs do, but it's not as harmful. We just enjoy eating cookies and chocolate and we can go on about our day. But that is not the case with drugs and people who are addicted to whatever substances, whether it be alcohol, drugs, nicotine, anything like that. And substance use disorders, they don't just develop overnight. They don't just develop because of a single cause or the lack of willpower to say no. They tend to result from a combination of biological, psychological, and environmental factors. Things like genetics and trauma, mental health conditions, stress, and even early exposure to substances can all increase someone's risk. And when talking about early exposure, too, a big part of that is families. Families who use around children or have their children participate in their use, their children tend to grow up and have substance use disorders. And that they don't really know how to get help because they grew up watching their family do this and that's normal to them. So, some things to keep in mind when thinking about substance use disorder are the symptoms, right? When you use a substance, can you put it down or do you continue having cravings? Do you feel like once you start, you have a loss of control? You just cannot stop. The tolerance as well. The more you use, the more your tolerance is going to go up, which is very dangerous because that can lead to overdose. And even in terms of alcohol, alcohol poisoning is a form of overdose. You should not be blacking out when you drink. So that's something to keep in mind when looking for signs of substance use disorder, either amongst yourself or your friends, peers, family, classmates, anything of that nature. And continued use despite harm. I know that during my active addiction, I would get in trouble for things. I would have consequences, negative consequences for my actions. And despite all of that, I did not care because I could forget by drinking or I could forget by smoking. And that's not a healthy way to live. That also includes a loss of interest. I started to neglect my responsibilities because I just didn't care, because that wasn't fun to me. That wasn't important. What was important to me was the craving that I was having, and I would want to get that substance in any way that I could. Typically, it would just be as long as I had the money, I would do it. But there's other people who go through other measures to get their substances, and by having these symptoms, you can start to identify that someone has a problem, and that's very important when trying to seek treatment. And when even considering treatment before we can get there, there's a big barrier to recovery, and it's not even the lack of treatment options, it's the stigma associated with the disease. Stigma refers to the negative attitudes and stereotypes that society places on people living with substance use disorders. Think about an addict. You probably are going to think of someone who lives in the streets or who sleeps under a bridge, walking around with a brown paper bag and alcohol, or a junkie that's shaking and jittering, like all these negative connotations you think of when you think of addicts and addiction. This is stigma, and these beliefs can cause people to feel ashamed or fear being judged, which can lead to them delaying or even avoiding treatment altogether. I know for me, I didn't like the idea that I was struggling with this problem, and I was afraid to admit that I had the problem. And so consequentially, I didn't want to seek treatment. But a simple way that we can work on reducing stigma is by changing the language that we use. Instead of referring to someone as an addict, we can say that this person has a substance use disorder. This is what's known as person first language, and it recognizes that addiction is only one part of someone's life and it doesn't define who they are. When people feel supported instead of judged, they are more likely to ask for the help that they need and will feel more motivated to follow through. Sometimes people ask for help and they just can't see it through because everyone around them still continues to have this negative stigma about them. And so some of the pictures I put on this slide was just to show what we think about when we think of this topic. We don't think of positive people, but in reality, addiction can affect anyone. You can have doctors with addictions, you can have lawyers with addictions, you can have a regular mom who goes to work, comes home, feeds her kids, she can have addiction. Anyone can fit in the substance use disorder, and it doesn't have to just be the connotation that you have drawn up in your head. But the good news is that substance use disorders are treatable and recovery is possible. Evidence based treatments can include behavioral therapy, counseling, medication assisted treatment for certain substance use disorders, and peer support groups. These approaches have been shown to improve recovery outcomes and help individuals build healthier lives. Recovery isn't something that just happens overnight, and like many chronic health conditions, it's an ongoing process that may include setbacks along the way. But a relapse doesn't mean that someone has failed. It simply means that they just need additional support or adjustments to the treatment plan. The earlier that someone can receive help, the better that their chances are of long term recovery, and that's why education and reducing stigma are so important. I also included the AA circle and the CHIP because for me, that's something that I pursue, a 12-step program, and it's focused on service work, recovery, and unity. And it's finding like minded people that also have gone through things that you've gone through, and they can help support you while you're in that journey, because not everyone's going to understand, but it's really important that when you're getting treatment, you do as much effort to see it through. Or if there's someone in your life who needs to get treatment, be supportive of them. Go with them to AA groups or any type of anonymous group. They have Narcotics Anonymous and other things of that nature. Just be there and be supportive. And if they mess up, again, it's not that they failed. It's a setback and they need to readjust and see what works better for them moving forward. So, overall, today, what we've learned is that substance use disorders are complex medical conditions and they're influenced by many factors. We've also discussed how stigma creates barriers that prevents people from seeking treatment and why using respectful person first language can help reduce those barriers. Finally, we've seen that recovery is possible through evidence based treatment, support, and compassion. I know for me, I had to go to rehab before I could even consider AA. To me, that seemed like the proper next step. And when I came out of rehab, I relapsed. But again, that didn't mean that I failed. I kept on trying and I kept on showing up, and now I'm sober. And what I'd like to do today is leave you with one final thought. Addiction can happen to anyone, but so can recovery. And sometimes the most important thing that we can do is replace judgment with understanding, because one supportive conversation could be the first step in someone's recovery journey. And thank you all. If you have any questions, of course, please don't hesitate to comment. I've also included a list of sources that I use to gather some information, but some things that I've listed here is just through firsthand experience by going through treatment programs and getting help myself. So I do look forward to any questions, but that's all. Thank you.